Hi, Dr. Sasse here from the Incontinence Center in Nevada. So I'm going to talk a little bit about sacral neuromodulation and the steps that are done. As you may know, if you watched other videos or you've looked into this, sacral neuromodulation is what we think is the best kept secret in medicine. It's the most effective treatment for resolving bladder leakage and bowel leakage and restoring the pelvic floor. It's FDA approved, it's covered by insurance plans, and it's done in 2 steps. So the first step is a trial and the second step is the actual implant of the permanent device. So if you hang in there till the end of the video, I'm going to give you kind of a key tip of how to make sure you get the very best result overall for the long term. We're a little bit stuck with this trial and then implant sequence because that is the way the regulatory bodies sort of looked at it from the initial onset of the technology, as well as other similar technologies such as neuromodulation for pain, for example. So typically some leads are placed, some programming is done, and the computerized gentle current is sent, and people get a sense of whether it's working or not working, or more importantly, whether it might be causing some adverse side effect. And in some instances, this probably makes a lot of sense. But now fast forward, 2 decades plus with sacral neuromodulation for the pelvic floor and for the bowel and bladders, it's exceptionally rare that there would be any funny adverse effects that we wouldn't detect, and so you can make a really good argument for abandoning this 2-step process, which is more cumbersome and requires a whole extra visit to the hospital and expense and so forth. But nonetheless, until that changes, we still live under this framework where we do a trial and then proceed with the implant when the trial is successful. And that measure of success is typically that a person has experienced more than a 50% improvement in the bowel and bladder control, and it has to be kept by diaries where you really write down how things are going and the number of accidents and the frequency of accidents, and that indeed it's been a 50% improvement. I'll tell you that most of the time it's a much higher percentage than that of actual improvement, but there's a couple of reasons why the trial is very imperfect and why it really doesn't speak at all to the success of the eventual implant. The primary reason is that the trial leads are not stuck in place. They're meant to be placed and to be easily removed. So that means that when you move around and with positioning and standing up, sitting down, squatting, getting out of bed, it's possible that those trial leads could move just a little bit. And the precision with which I place those leads is very great. So even a small movement or migration can make a big difference on how well the trial device is working. So it's very common for people to report that for the first 24 to 48 hours, the trial is working amazingly well. They've had no accidents, their pads are dry, they didn't have to get up at night. Really great, but then after a couple of days, it doesn't seem to be working as well, and they're not so sure after that. Well, that's almost always a result of the trial leads moving or coming out of position. So really it takes a little bit of kind of understanding and education to get the most out of the trial and not end up shooting yourself in the foot and denying yourself from getting the very best treatment that'll vastly improve your quality of life just because of the imperfections of this required trial implant. But what do you do if the trial itself does not seem to be successful at all? We had a case like this recently where in the operating room, as I was testing the leads, I could see that this system is going to provide immense improvement for this person who's been suffering with terrible bowel and bladder leakage for quite some time, especially her bladder leakage. That's just been total misery. And I could tell by the responses we were getting with our computer testing in the operating room during the trial placement that this is going to work great for her because of the response we were getting with her pelvic floor muscles and sphincters. But by the time she got home, the leads had migrated and she wasn't really getting that same response herself. She continued to have leakage during the several-day trial period. And when we took the leads out and talked to her, she said, I couldn't really tell that this was going to be that great, and she wasn't sure she wanted to proceed. Armed with the knowledge that I had seen how well the response of her pelvic floor was, I knew that this was going to really solve her problem, and I just felt terrible that she might just not do it because of the imperfections of the trial. And so you do have another option, and that option is to proceed with a second trial, but it's done a little differently. It's done as what we call a staged implant. We refer to it as a stage 1 procedure. And in the stage 1 procedure, we actually place the fancy lead that is what we call the quadrupolar lead. That's the one that has all 4 contact points on it, and it does not migrate. It's a very sophisticated lead. And we carefully place that, but then we connect it in a way that it's connected to a trial device. This now has the advantage of giving all the effectiveness of the actual permanent device without migration of the leads. And so in those cases, a person can almost always get the real effect that they're going to have from the permanent implant. And in that case, usually it eliminates this whole problem, and so the person can give the thumbs up and get the benefit of having resolution of this dreadful bowel and bladder leakage. So, what should you do? If you're in this boat and you first undergo the trial and you pay attention to your symptoms, if the resulting improvement is really good on the first day or 2 but then diminishes, really hang your hat on the results of that first day or 2, because that's when the leads were in the best position. Secondly, if you just get bad luck and you don't have good results at all with the trial, which doesn't happen very often but once in a while, then ask your doctor about the staged implant process and if you might be a candidate for that, because there you might really see how good the actual device could be. And remember, the permanent implant is a very small procedure. You walk out of there with 2 small Band-Aids. This is a very minor procedure in comparison to surgery, for example, say pelvic floor suspension or some kind of prolapse repair that I might do, which are much more invasive. So it's really worth trying to explore sacral neuromodulation technology because it has the very highest effectiveness, but it's a very low invasiveness intervention with very few side effects and very few things that would cause you trouble. So I hope that made sense, kind of untangling the details and the mechanics of the trial, the potential problems with the trial, and the importance of relying on your early impressions after the trial leads are replaced, and then considering the staged implant if you didn't get a good result. I hope that leads you to have the very best result of resolving any problems with the pelvic floor and bowel and bladder, and I really hope that our clinic or another expert center like ours can be helpful to you in this journey. And I wish you all the best.